Hi. When it comes to having a sexual relationship with a spinal cord injury person, there are some things that you must keep in mind. The first thing is communication. Communication is the key. Open and honest communication with your partner is essential. Discuss your desires, concern, and any physical or emotional changes that you have experienced. Talk about what feels good and what doesn't, and be open to trying new things together. Explore different positions and techniques. This is must. Otherwise, you may feel frustrated. So, depending the level of your injury, you may need to experiment with different positions that are comfortable and manageable for both of you and your partner. Explore alternative techniques for stimulation, such as using hands, mouth, or other body parts. Experiment with different angles, pressures, and rhythms to find what works best for you. You can also use assistive devices and aids. These can be really helpful for you. There are various assistive devices and aids available that can enhance sexual experiences for individuals with spinal cord injury. Vibrators, lubricants, sensory aids, and adaptive equipment can help you in achieving pleasure and maintaining intimacy. Consider exploring these options and consulting with a healthcare professional or a sex therapist for guidance. They can guide you better. Then incorporate sensual activities. Apart from being sexual, you need to be sensual. Intimacy doesn't solely revolve around sexual acts. Engage in sensual activities that promote closeness and pleasure, such as massages, kissing, cuddling, or taking a bath together. Focusing on the overall sensual experience can strengthen the emotional bond and enhance sexual satisfaction. Manage physical challenges because they are there. Depending on your specific challenges, you may need to find ways to manage them during sexual activity. This could involve using positioning aids, specialized cushions, or adjusting your environment to ensure comfort and safety. Make any necessary adaptations to accommodate your needs and minimize discomfort. Otherwise, you won't feel pleasure out of the act. Then you can always explore erogenous zones. These are everywhere in our bodies. These erogenous zones on the body that can still provide pleasure, even if the genital area is less sensitive or affected by spinal cord injury. Experiment with areas such as neck, ears, nipples, inner thighs, or other parts of the body that are responsive to touch and stimulation. Engaging in sexual activity while having a catheter in place can present some challenges, but it is not impossible. Here are a few tips to consider. Consult your healthcare provider first. Before attempting any sexual activity, it is crucial to consult your healthcare provider or healthcare professional familiar with your specific condition and catheter. They can provide personalized advice and guidance based on unique circumstances that you may have. Ensure comfort and safety, that is must. Prioritize your comfort and safety during sexual activity. Make sure that catheter is secured and properly placed and not causing any discomfort or pain. Use positioning aids for that. For example, pillows to find a comfortable position that can accommodate the catheter without putting pressure on it. Communication with your partner again is the key. Open and honest communication. Discuss your concerns, limitations, and any specific needs related to catheter. Ensure that both of you and your partner, are on the same page and comfortable in the situation. Then with catheter, again, non-penetrative activities can be tried. And these activities can still be pleasurable and these can be intimate. Focus on activities such as, again, touching, oral sex, or mutual masturbation. These can provide pleasure and intimacy without interfering with catheter. Use barriers and precautions. If you and your partner choose to engage in penetrative sexual activity, it is important to take precautions to prevent infection and ensure hygiene. Consider using condoms or other barrier methods to protect the catheter and reduce the risk of contamination. Lubrication is important. Depending on your specific circumstance, a catheter may cause dryness or discomfort during sexual activities. Using a water-based lubricant can help reduce friction and enhance comfort. But try to avoid oil-based lubricants as they can cause damage to the catheter. So take it slow and be patient. Adjusting to sexual activities with a catheter may require some trial and error. Take your time, be patient, and listen to your body, and also listen to your partner. Pay attention to any discomfort or pain and adjust accordingly. Remember that sexual pleasure and intimacy can still be experienced even with certain limitations. But don't forget to seek professional guidance. If you're encountering specific challenges or struggling with aspects of your sexual relationship, consider seeking guidance from healthcare professionals and specialize and those who specialize in sexual rehabilitation or those who are sex therapists. They can provide tailored advice, techniques, and support to help you navigate these challenges. It is important to note that these tips are general suggestions and it's essential to consult your healthcare provider first. But anything you do with your partner, any sexual activity, consent is must. Never forget about consent. And remember that everyone's experience and preferences are unique. So it's important to find what works best for you and your partner. So try, have fun, have pleasure. Don't be scared, be relaxed.